USNH Naples staff and beneficiaries. I'm Lieutenant Kate Rooney.
And I'm HM2 Apollo Silva, and you're watching Hospital Hotspot, our news program that brings you the latest news from USNH Naples.
It's the middle of PCS season, and we realize many of you are new to the area and new to USNH Naples. In the spirit of welcoming all the new faces, we are taking a different spin on Hospital Hotspot for the next few months. Today we bring you a series called Smooth Transitions. This series will answer many questions all of us ask when we arrive to a new duty station and hopefully help make your transition to life in Naples as smooth as possible.
All right, for today's segment of Smooth Transitions, here with us today is Commander Rudman, the Director for Dental Services at USNH Naples. Thank you for joining us today, Commander.
Sure, no problem. Happy to be here.
So I have a couple of questions regarding the dental operations and the policies that we have here at the command for all our beneficiaries in our community. The first one being, what type of services does USNH Naples offer to our beneficiaries?
Well, we really have the full range of services here in the Dental Directorate. We have 4 general dentists here, as well as 3 stationed at the Capitoquino branch. In addition, we have all of the dental specialties represented here. We have a prosthodontist, we have a periodontist, we have an endodontist, a root canal specialist, we have an oral surgeon, we have an orthodontist, and we have a pediatric dentist. So really there's nothing we can't accomplish here in the scope of dentistry to take care of our patients.
Good to go, sir. Thank you. My next question is, what type of procedures and surgeries are the beneficiaries here in our community eligible for? Active duty, dependents,
Sure.
GS employees, anybody?
That's a good question. Our primary beneficiaries here, the people that we need to ensure that we have availability of appointments for, are our active duty service members and their dependents who are stationed here with them. And to them we offer the full range of services. The only exception to that is we do not do dental implants for dependents, and that's just by instruction. We're not allowed to do that. But aside from that, every other full range of services are available. For other patients who are beneficiaries, for retirees, for their dependents, for civilians who may be stationed here, or people who are for foreign military who may be stationed with NATO, they are seen on a space available basis. So if we have space in our schedule within the next day or two, we're able to bring them in. Now, ordinarily for general dentistry services, things like fillings and cleanings, there isn't a lot of space available. We're a very busy clinic with our primary beneficiaries. So there is limited space available for those services. However, for other services such as oral surgery, getting your wisdom teeth extracted, or a root canal, we do have more availability and are able to see those patients. Most importantly, for all of our beneficiaries, we always make time and have space to see them for emergencies, for sick call, for people who are in pain. We always take care of them and do the best we can to get them comfortable. And it's important, we also try to encourage people, if they are not eligible for care here on a routine basis, that they seek the services of a dentist in the civilian sector to act as the primary dentist who will be doing their maintenance and their regular visits. And then obviously we would be able to see them if there's space available, and to augment the care they're receiving.
Right.
Sure.
Okay. Sounds good. My next question is, for those who are considered space safe, what kind of procedures and treatments are they allotted here in USNH Naples?
Well, what we have been doing the last couple of years for our retirees who live here is around Veterans Day in November, we've been hosting a retiree appreciation days, usually 2 days, where we open our schedules up specifically for retirees and their dependents for cleanings and for examinations and treatment plans. It's a way to say thank you, it's a way to stay connected with our retiree community and to make sure they're getting in at least once a year. And hopefully, that's a great service we've been able to provide for anywhere from 60 to 70 patients per year. We've done that, and we will continue to do that this November.
That's very kind of your department.
It's the least we can do.
So my next question is, I know that myself and many other sailors and their families, we always hear follow-ups and phone calls regarding to dental cleanings. Can you elaborate on how many dental cleanings we're allotted a year, or the procedures?
Yeah, we get a lot of questions about that too. I think sometimes there's some confusion, misinformation maybe about cleanings, and part of that is because as active duty service members we are aware of the fact that we have to come in once a year for an exam, and usually you get a cleaning once a year. So sometimes people assume that, well, if I'm going to a Navy clinic, I only get one cleaning a year. That's not entirely true. What we do is we base our decisions on individual patient needs, which is really how it should be. So someone comes in, they get an examination, and we may determine that it's appropriate for them to get a cleaning every 6 months based on their health condition, based on the status of their gums and their oral hygiene. For many of our patients, so if they have outstanding oral hygiene already, which a lot of our patients do, and their gums are healthy and they're doing the right thing, maybe once a year is appropriate for them. On the other end of the spectrum, if someone has periodontal disease or gum disease, or has having more issues with inflammation and disease, we may say we need you to come in every 3 to 4 months. Okay, so that 6-month model that we're used to in the U.S. is traditionally based on insurance companies, and that's kind of what they will pay for every 6 months. We feel it's more appropriate to base our decisions on individual patient needs rather than just an arbitrary number that we assign to everyone. So that's why some people who are used to getting a cleaning every 6 months, our recommendation here may be once a year, and we feel that's a more appropriate way to treat our patients based on their individual needs. And once we explain that to patients, they usually if we say you only have you need a cleaning once a year, that's a good thing. It means you're doing the right thing, you're healthy, and we just need to see you once a year.
Good to go, sir.
Sure.
Now, for my last question is, since you are a dentist, I'm sure you can agree that dental hygiene is very important. Are there any tips that you can give to our community regarding to good dental hygiene?
Sure. Well, everyone hears and everyone knows about you're supposed to brush twice a day, and you have to floss, and people are probably tired of hearing dentists lecture them about those things. So my tips would probably be more something along the lines of tips that people might not have heard about before, that they might not be aware of. One of the things is very important for people to understand who have had cavities before, who have had decay, or what we call caries before, who are at risk for having it in the future, is to understand that it's not just eating sweets or how much you have, how many carbohydrates you have, because it's also important to know it's not just sweets or sugars, really any kind of simple carbohydrate, chips, crackers, people like to munch on that kind of thing, pretzels are going to be at risk as well. It has the same effect in the mouth. The important thing to understand is it's not just the amount of sugars or carbohydrates, it's the frequency with which those are taken into the body. So people that tend to snack all day long, or sip on Gatorade or soda or coffee with sugar, sip on it all morning long, are going to be at much higher risk because the bacteria in your mouth take the sugar and produce acid. It's that acid in your mouth that leads to decay. And the longer that acid is in your mouth because of the frequency of intake, the higher risk you're going to be. So we try to make reasonable recommendations to patients. Sometimes it's not reasonable to expect someone to cut out all sugars from their diet because we're humans, we love our sweets, We try to just give reasonable recommendations and say, hey, if you have to treat yourself to some candy or something that, most dentists wouldn't want you to have, it's best to have it at mealtime and just have it and be done with it. Or if you're going to have something with sugar in your drink, just drink it rather than sipping it throughout the morning. So frequency is important. The second piece of advice along the same lines is, when you brush your teeth, especially at nighttime, one recommendation is after you've flossed and brushed your teeth, you brush your teeth with fluoride toothpaste, spit out, and go to bed. Do not rinse with water after you've brushed your teeth. You can spit out the extra saliva and extra toothpaste. The reason is we want that, the longer that fluoride in the toothpaste stays in contact with the teeth, the more effective it is. So we know that concentration of fluoride and the length of time it's exposed to the teeth. If you rinse out with water immediately after brushing, it lessens the effect of the toothpaste. So that's something a lot of people aren't aware of.
All right, good to go, sir.
Sure.
Well, there you heard it. A lot of great information regarding to dental hygiene and our dental policies and operations here at our command. Thank you, Commander Rudman, for joining us and giving us all this information.
No problem. And I would just add that if anyone has any questions at all about our services, our front desk staff here is very friendly, very knowledgeable, and even if they can't answer your questions, they can point you in the right direction for someone who can. So.
Thank you. That's it for today's segment on Smooth Transitions.
Thanks, HM2.
That's all today on Hospital Hotspot. Remember, you can always keep up with USNH Naples by following us on Facebook. Until next time, for USNH Naples Public Affairs Office, I'm Lieutenant Kate Rooney.
And I'm HM2 Apollo Silva, and we'll continue to lead the change to better health.